You say intro, I'll do it on my own.
No, I'm just saying because I always hear your intros, the long intros.
But because we are starting something new, usually that's audio, right? Yeah, this is video. How would you like the intro to go like? If you were to introduce yourself, who is Kwanele?
Who is Kwanele?
Because I feel like usually when you get someone's...
Yeah, you can say that. We can start by that,
Then that would be the intro.
Yeah. But then, when someone says, tell me about yourself, yeah, that's when you're like, yeah, you don't know yourself. You're like...
I think that's the one question that I fumble most.
Yeah.
Where I'm working now, they asked me to say, why should we hire you? And I didn't plan that. And I did not plan that.
You can't plan that.
The first answer was like, because I'm a citizen of Johannesburg. That lady looked at me and I was like, we've never heard that one. You're not going to tell us about your qualifications and what? I'm like, I didn't prepare for this, honestly.
No, I think for me, why should we hire you is an unfair question. It's a stupid question that employers should remove from their questions because you're the only one that knows who you have interviewed.
Yeah.
So I cannot come here and try and compete with people that I don't even know. Who did you put in place? The fact that I'm here sitting for this interview, I deserve to be here. Do you understand? The fact that you called me, which means I have qualities that you think I might be able to do the job. So you're the one that has the disposal of information of who did you interview, who do you want, and what do you want to do with those people. So I can't vouch for myself, but the fact that I'm sitting here, it shows the commitment that I woke up, I took a bath, I dressed up, and I showed up. So you hire me or you don't. Like, I'm telling you, and I've answered that question, I think, differently in all my interviews because it also depends on how long. There was one interview I went for an hour. Sure. I was so tired by the time they asked that question, and I was like, I'm tired, I'm exhausted. You didn't even offer me coffee, so you should hire me. You owe me a lot. I'm telling you. And they just looked at me like, you want coffee? I'm like, you've been asking me for an hour. I've been talking. I'm tired. Like, for crying out loud, I've given you everything that you want. You wouldn't want to hire me. Like, seriously.
So if someone was to say that...
And they hired me. I got the job. Because I was genuine and I was at my most genuine because I was exhausted. I talked for over an hour in that interview. And sometimes, people say that in interview, if you're going to get the job, it has to be long. Because if it's short, it shows that they're not interested in you. The more they keep on asking you questions, the more they want to know you. They've made the decision already. They want to hire you. They just want to cement that decision. I hate interviews. So it's so long. And I'm just there like... Oh, and then this one that I'm with now, it was the shortest interview ever. And I even doubted that I'm going to get the job because this is what they asked me. Tell us about yourself. And then I tell them, but they're no, we want to know you. Are you married? Do you have kids? Where do you live? What do you like? What are your hobbies? What do you do on weekends? That was the first I've ever been asked in a job interview. And I'm like, oh, I'm a mother of one. I'm married. I live with my husband. I live in Rosettenville.
And by that time they catch you off guard because you didn't plan or practice.
And I'm like, okay, what do I love? I enjoy spending time with my family, and I don't have much of hobbies because I'm at school right now. So half of the time my weekends are spent trying to type things, trying to read articles, trying to get my work done, and that's it. I have 2 dogs, I have 2 pit bulls, and yeah, that's it. That's me. And actually, that is what they were interested in.
Not the qualifications.
When I got the job, that family business.
Oh.
They want to know about people.
They want to see how you're gonna fit into this family that they're building. How you're gonna
fit, and they also, I think now I'm realizing now that they also want to accommodate that family structure that you have. They don't want to squeeze you with your work and forget that you have kids. They want to accommodate that structure. It's so beautiful. It's a point that you're like, oh, okay, because now they know that you have a child. You even like, I have literally a day off in January to drop off Polani at school.
Wow. Oh, wow.
So, it's those things.
That's a caring employer.
You understand that, they care. They really, you say my daughter is sick, they take it seriously. They like sit at home with your child.
Now you can pull the thing off. I want to take my dog to a vet.
Exactly. If they know you have dogs, they know all those things. So I think that is the whole point, that they say, tell us about yourself in that level, because already they've seen your CV. I thought that interview was based on that they've seen your CV, they've seen that what you can do and what you can't. So now we want to know you as a person. Who are you behind that CV? How human are you? You know, how far can you go? What can you give us as a human being?
Me, when it comes to interview, I suck.
And it was like 20 minutes, I was done. The following day, they called me like, you got the job.
Just like that.
Just like that. I'm like, but I didn't. And I kept on telling them, like, I'm so anxious. They did not ask me a lot of questions. Nobody's like, these people have already hired you.
They knew what they wanted.
They just wanted to meet you and hear what you are about. That's it. How do you talk? But you have been hired before you were hired. And I was like, wow. So they're not the same interviews. There's long interviews and there's those short interviews that you just like, done.
Quick.
Yeah.
So this one not being an interview, a formal one. All right. So if I was to construct an introduction, and then I was to say, tell me about who Kwanele is, what would you say?
I would say I'm Kwanele Mbazo. I'm the firstborn. I'm the big sister. Yeah, but I'm proud of being a big sister. I've actually lived to be a role model and be a big sister. So I'm the big sister. I have one sister. So there's two of us from my mom, and I'm a mom of one. For now, I'm a mom of one, and I'm also a wife. I'm an aunt. I'm a daughter, obviously, and I'm an educator.
You just had a smile when you said when you said I'm a big sister, you were like, okay, but now when I'm an educator. You love education.
So, I do.
Teaching.
I love teaching. I've always loved teaching. I think when I started my undergraduate course, my nursing degree, I've always enjoyed teaching. I think I taught most. You were my classmate, I guess. I really taught a lot of people in class. I really, I realized that I have a skill of disseminating information in a different way, or understanding it in a way that maybe I can make another person understand. Because sometimes you can understand something, but you cannot.
But you can't share it to someone else.
You can't share it to the next person. But half of the time when I shared it to someone, and they'll come back and be like, I passed just by listening to you.
Yeah. There are those people that just need to listen.
Okay, I have something. There's something in me. So I can understand something, and then I can try and break it down into small quantities and then give it to someone in a simplest form. So for me, I was like, okay, maybe I'll go into education, though it was not what I wanted to do. But I was like, okay, which means I'm good at teaching. So that's where it all started. And I was like, I would love to stand in front of someone. Maybe instead of being that nurse in clinical, I can inspire other people in academics. And be the first person that comes into contact with a student. Be the first person that plants that ethical value, that academic value, that theory value, or that clinical value before they can be handed over to the world. I think for me that was also the influential part of education, that you're the person that comes with the information. So you need to know your story. You need to understand your story. So you are that influential because you're the one that comes with information. You're the one that comes with also that hidden curriculum that students pick from you without you intentionally saying it to them. So you carry that. So I think I just loved being that person of influence, and education was that platform for me to be like, you know what, I can be an educator.
Were you always like this? Even when you were like growing up, I see my sister, she would, whenever she's with a friend, she's the one that is drawing, telling them to do what, so you being a firstborn and you loving teaching, your childhood, was it also like that?
I think I've been like that all my life. I've been that student. There was a point of time in my life I was a top student. Then in high school I was lazy. I think a lot of my high school teachers were always like, Kwanele is lazy. They always tell my mom that the son can get distinctions, but she is so lazy. But then what I know is that when I teach someone, I don't forget it. So for me, that was more of a strategy of studying, because I was so lazy to study. So I'll be like, let me read just to go and tell someone the story that, this is how it is. This is the process. So for me, I used it as a way of passing so I can pass and move through to the next round. Because when I finished my matric, and then I went to Vids, and I was doing a BA law, so I did all my subjects, then there was no time to teach anyone. With Vids, it was more like you need to study and pass. So my good marks from where I started, I just became this average student. So I was like, you know what, we're passing, we're writing and passing. Yeah, 65 was a distinction. At Vids, 65 is
it's the thing.
When you go to the notice board, you're like, 65, like, yes. Because there's no one who there's probably one person who got 80. After that, the rest is 60s. So for me, it was like, I valued education. I know for a fact that from a young age, I've loved education. I'll cry if I don't go to school. I will cry. So I've loved going to school. I think it's one thing I've told myself, that I don't have a talent. I can't dance. I can't sing. So what can I do? I can sit down, read, write a test, and pass. So for me, I use that as my, my biggest strength. So everyone who knows me knows that Kwanele will talk about school the whole day. The whole day. I can speak about school
How do you love school? I mean, when you, especially, let's say in high school, and you're saying that in high school already you had, even though you were being considered the lazy one, but you still had this thing of, let me read so that I can teach someone. How do you get to that point? I hated reading. God forgive me, I hated reading. No. My mom would shout at me, say, Funda. I hated reading.
No, I'm telling you.
Why? How did you get to that point where you enjoy sitting down with books?
I think it's a spirit. It's just like, it's something that takes, truly, it's something that takes over you. Like my mom is one person that will always be like, go to school. And sometimes, parents say that, and they'll have a kid that is not receptive of that advice. But I feel for me, because from a very young age, I loved school. I just loved school. It felt like a safe place for me. It felt like a place. I think also, what came about was the fact that when you pass, you recognize. And I'm short. When you're short, like, everyone thinks that you're stupid. They think, this one is short. What is this one going to give us? So when you start passing, you start being invited to prize giving day. It's you. And you actually draw a lot of energy from that attention. It becomes it consumes you. You want to pay for
addictive.
more.
You get addictive. Yeah, we are addicted to it.
Exactly.
I wanna be seen. I wanna excel.
And you know what's so funny? I found there's this other article that I was reading. These psychologists that analyze kids from firstborn, secondborn, thirdborn, and they're like, firstborns are achievers because they are role models. They always have this thing that there's someone who I have to do for so that they don't fail. So that they don't look up to me and fail. So I think maybe because of my role in that, being a firstborn, it pushes you to be better. Because me and my sister are like 6 years different. We have a 6-year difference. So she came very quickly in my life when I was studying my primary school. So that there's someone behind you that is always looking up to you at a very young age. And when your parents are like, yeah, you have a little sister, and so you start being that person that has to be perfectionist. I think that is why I'm also like that. I obsess over a lot of things. So you become a perfectionist because you're scared of the one that is behind you. Like, what is she gonna learn? If I make a mistake, she will make that mistake too. Sure. So now I have to shape my way. So that's what I'm saying. For me, the only talent I had was to read and write, and it worked for me because I was reading and writing and passing.
But so much pressure, though.
Yeah. I was reading and writing and passing.
I wouldn't survive. It's too much pressure. I am a firstborn, but I feel like it's too much pressure. It's too much pressure. When do you rest? When now do you start saying, I'm just gonna chill, man? And whether they want to do their own things as a second and third born, man, they will see themselves.
No, but you never rest because that's your responsibility. I think it's something that is embedded in you as a firstborn because you can't ignore it. You can't ignore that you have a little sister or a little brother that is looking up to you. And you can't ignore that all hope is on you. You're the one that has to break every curse because every curse will start with you. It's difficult for a secondborn to break a curse.
Dude, were you thinking like this even as a child?
Yes. You have a curse to break. And I remember, I knew that in primary school, I found out that actually I thought a doctor is someone who's a medical doctor.
Yeah.
Then I found out from one of my teachers, they're like, someone was studying for a PhD. I'm like, what is a PhD? They're like, it's a doctorate. I'm like, how do you get a doctorate? They're like, no, you go to university, you study for masters, and then you get a PhD. I'm like, so I can be a doctor without being a medical doctor? They're like, yes. And I remember I was like, I told my mom, like, I'm gonna have a PhD.
Which is what you are working towards on.
I'm gonna be a doctor. There's no way, because I thought it was gonna be, because I didn't want to be a medical doctor.
Yeah.
So when I heard that there's something called a PhD in every field, I'm like, guess what, girl? We're getting that.
Dr. Mbazo, how far are you from achieving that?
I'm one step away. I just need my master's.
Now you're really close.
I just need my master's, then I'm in. So it's so much pressure because you realize that there's no one in your family that is educated, and you're the only person that has that chance. And if you do have that chance, everyone that follows you will take it.
Yeah.
There's no way that my sister is gonna say she doesn't want to be a graduate. She has to be.
Because she has seen it.
She's seen it, and she's gonna be like, but who am I to think that I can't get this? You can. I'm trying to make it possible. For me, it was a gift to my family. I'm making it possible for generations to come. I'm making it possible to my daughter. You know, I was even shocked this other day. She was like to me, Mommy, I want to go to university in Michigan. Nah? Michigan where?
And by that time, what grade is she doing?
She's in grade 5. I'm like,
grade 5.
Go ahead, girl.
What was I thinking in
what
grade
was
5?
I even thinking? Here's this child telling me about universities in Michigan. I'm like, okay. For me, I knew that I had planted a seed. The moment when she starts talking like that, I'm like, the seed has been planted. I didn't have to communicate with her like that.
And now for her, obtaining a degree, it's something that is not even, you know, it's something that it has to happen.
It's part of life.
It's part of life. I mean,
like a metric certificate.
How do you live? Exactly. You are setting the bar because there's time at home where they're like, you have to get a metric certificate at least. And here the language is changed now. You have to get a degree at least. And you are going to for your PhD now. Dude, how do you survive and live without a master's?
So but it's a personal thing. I think that's what I keep on emphasizing to people, that I found my forte or my niche. I found something that taps into my soul. And I think once you get that as a person, it can be anything. It should not be academics only. It can be anything. It can be business. It can be money. Once you tap into that, no one is gonna touch you. You're untouchable. Once you tap into your potential, once you understand your own potential, not the next person's potential, but yours, you're untouchable.
What are you good at?
Yeah. You need to find what you are good at. Because we can preach now and be like, yeah, nursing degree, I have a nursing degree, I'm going there, but this could be my dream.
Yeah.
You know, and I understand the passion and the fire that burns from within me. That's why I always advise people that find that fire within you, then ignite it.
How do you find that fire? You know, finding that fire, finding that purpose, find the purpose of why you are living, find this. How do you get that?
Yeah.
It sounds so philosophical.
It is.
Because, I mean, dude, how do I even begin to search for purpose? What is my purpose in this life? How do you get that? Do you pray about it? Do you go to church? How does one get their purpose or find their purpose in life? How did you find your purpose in life?
It's one hell of a spiritual journey, I think, because when I say spiritual, I'm not on religious basis. I'm talking about everything, you know. What do you do to find your peace in a time of chaos?
Yeah.
Do you pray? Do you talk to God? Do you talk to your ancestors?
Do you isolate?
Do you take a walk? Or do you isolate yourself?
Yeah.
As long as when you come out of that phase, you feel like you are renewed, you can start afresh. So there's so many things that as a person, when we know that if I say this, you know, I always say, if I talk to God, things will happen. If I start talking immediately, something will happen. If I just demand and say, you know what, by the end of this day, I need this. I need you to give me a sign, like by the end of the day. I swear to God.
It does happen.
It happens, you know. Sure. When I tell people, they just think that this one is great. I'm telling you, if I say by the end of this week, give me a sign.
Who reduce must happen, this is it.
I'll get a sign. And immediately I trust that sign because I asked for it. Because most of the time we'll ask for a sign, and when it comes, you start questioning again.
Is it a specific sign? Like
it's
God?
Specific thing,
so here I am now. I'm trying to find the purpose. God, if what I'm doing right now It's what I'm supposed to be. It's part of my purpose. I don't know what sign can I ask.
Sign. No, you don't ask for a specific sign. You just say, give me a sign. Because I remember there was a time that when I was working at Barra, I left Barra.
Yeah.
I just resigned. And
Unprovoked.
I was tired. I think there's another topic that we need to talk about is nurses. Burnout. Burnout is real. Burnout is so real that, you wake up in the morning and you don't want to go to work and you cry. You just cry.
Sure.
And I know a lot of nurses go through that. You cry. You don't even know why are you even going to work. You've lost your purpose now. And that is another thing, because now you don't even know what are your goals at the end of this week. You need to have that. What are your goals at the end of this year? And it's gone. It's gone with the wind. And I just resigned. I was like, you know what, this is not healthy for me. I'm done. I'm going to resign. And I did not have a job. And I did one interview, I think in January, and they didn't say anything. They just kept quiet. They didn't even give me the feedback.
A ghost.
A ghost, exactly. Ghosted me. And I'm like, in my head, I'm like, should I send them an email and ask? I just kept quiet. I'm like, I'm going to be disappointed because they're going to be like, oh yeah, we found the person for the job. So what was happening is, at that time, I remember the first 2 weeks I was teaching, I was lecturing part-time online. It was COVID time. And then, that weekend I prayed. I was like, you know what? Something has to give. Next week, something has to give. On Monday morning, I was called for an interview at COJ. They're like, yeah, we want a professional nurse at Hebrew Clinic. Are you interested? No, do you have a job? I was like, no, I'm unemployed. They're like, do you want to have an interview? I'm like, yeah, I don't mind. It's fine. And then I'm like, that moment, I'm like, oh.
And this is a month after you.
No, this is like 2 weeks after I resigned. Now I'm at home teaching, and but then in my head I'm like, okay, I prayed for this, but now the question is, when I left Barra, I did not want to go back to clinical. Now this is my job, because they called me straight up. They're like, they want you,
But it's clinical.
And I just sat there and I was like, there was a part of me that was like, prepare for the interview. Then I was like, no. I went back again to the drawing board. I'm like, can you please give me a sign before Friday? Because they called me on Monday.
To show that this.
If they give me a sign on Friday, and the sign says go to the interview, then I'll go to the interview. I'll prepare for the interview on Saturday and Sunday. It's fine. But if I do get a sign, I'm not going into clinical. I don't want to go back to clinical. It's so stressful. It's on my shoulders. I can't do this anymore.
You know what I said to my manager? Now, before I could leave, I remember the last conversation. Well, it was not the last conversation, but on the last week before I resigned, actually on that week before I resigned, I had taken a bedpan to a patient. Right. When I get there, I've screened and I'm waiting outside so that she can finish. I'm wearing a white shirt, epaulets. When I go to work, I look proper. Then she's like, okay, I'm done. And as I'm taking the bedpan, cleaning, right? And I don't know if the gown was soiled, but it touched me. Ish. As I felt like everything is just on pause. Mdaka.
No, when I at least ukhuluma ngento enjalo. Yazi naye ngenza ngwenilanga. Phakathi elone recover. Patient iphuma ku C-section. Monitor. Now I have to expel the clothes. Pharma gloves. It's ngizokushisa. The glove. Nivese naqaqela. So kuyimino nje phakathi elinegazi elishisayo.
Directly like that.
I didn't even tell the patient because I didn't want her to feel bad. I just took my hand out. I continued expelling the clothes. Ngakhipha ngathatha i-linen saver ngamawulahla i-dustbin. Into engayigeza lapho. Oh. I couldn't eat that day. I couldn't touch food with my hands.
It's something else. I went to the manager and I told her I can't do this. She was like, okay, that's random.
Yeah.
I'm like, I can't. I'm not coming back again. I told Makumalo, I'm Mdaka. You can't see you coming back. We need to resign. I'm Makumalo. I said, no, like she did maybe someone like provoked me or had some feelings. Because she could see the concern, like, ubani, bakwenzeni.
Yeah.
But no, I'm sharp, sengrand. I said, no, sengrand, sharp, grand, angisafuni, sharp makumala. At time Mdaka, you can't resign, maybe at least try apply somewhere and then abakunikeza now to job something, you cannot just resign out of thin air. I have applied, but no, that time COJ hasn't responded. But I was like, I can't. And a lot of things happened in the hospital, but that day, what I felt that day,
you were like, shit, this is not me.
Shit.
I'm not deserving of this.
No.
There's a day that you get to clinical where you're like, I'm above this. This is bullshit. Period. I don't care what anyone says. I'm not going to judge people that are in clinical, but I don't care. But this is bullshit. This is beyond my brain. This is an insult.
Yeah. And she was like, no, Mdaka, phathi kufanele ungathi sharp, grand, ngizobona ukuthi kwenzakalani sharp. Yeah, angathi ngizoba sharp. Yes, I remember no mama time Mdaka, you can't resign in front of me. I understand that if you need time to go home, uhlale, but don't just resign. If you want, take leave. And I had like 17 days. We leave. Ngithi angifuni lawo ma leave. I resign. Sharp. So when you say you were burned out, I understand. Like,
no, I was still talking about my purpose. Don't jump
and think.
I need to start to edit other things.
Yeah.
So I was waiting. I had a phone call from COJ, and then I'm like, you know what? I don't want to go to this interview. It's clinical, and that's when I realized how people think around you. Everyone is like, but it's a permanent job. I'm like, what is permanent? Who said I'm gonna leave? Like, so it's permanent, and then what? What about my growth? I'm done with clinical. I don't feel like I'm growing, I'm learning, I just don't want clinical. I want something different. I want something that will expose me to other departments, other things in nursing. And then, do you know what's so funny? I was like, you know what, God, give me a sign by Friday. If you don't give me a sign that will convince me not to go to that interview, then I'll go to the interview. And I know that is my job. I'll take it. On Friday.
On the day of the interview?
No, Monday is the interview.
Monday is the interview, yeah.
I asked for the sign on Friday. On Friday, Vitz calls me with a letter of appointment. People that ghosted me for a month.
Well, that's a clear sign.
That's what I'm saying. That's all I tell people that, me now, when I speak to God, when I ask for a sign, and I know that this is a sign, I know that is Him communicating with me, saying, don't go for that interview, because I asked for it. I wanted something. I'm not even going to be choosing, because this was a 6 months contract.
Yeah.
And
over a permanent
post, but I wanted that experience. I was going to be a research nurse. Like, you hardly become a research nurse. You hardly get that exposure to go into the research field and see what exactly do they do. So for me, I was like, if this is 6 months, I'm going to learn to be a research nurse, I'm taking it. I can always be a nurse in a clinic anyway.
I mean, you're qualified any day.
That's what I'm saying. I can apply today and be a nurse in a clinic. But no, not research nursing. I'm taking the 6 months.
Before nursing, right? Before you, when I say nursing, before your undergrad nursing.
Yeah.
Did you do any work?
No.
I know you studied for doing law.
Yeah.
What happened? Why did you choose law?
Ooh.
Is it because you're trying to kuluma?
No, like, you'll be surprised. I love talking. I love talking with purpose, man. I'm an introvert. I'm not like
you introvert.
Yes.
I did young Swiss.
I don't disagree. I agree.
And that's what people don't understand. When I remember every time when I tell my students that I'm an introvert, they're like, man. I'm like, you need to find me in my introverted space. You will not like me. I'm such an introvert. I cannot survive large crowds. Me being in a large crowd means migraines, headaches. I have headaches and migraines, and I just want to sleep. When there's a lot of people, I'm done. Like, I can't stand large crowds. I prefer, people in personal spaces, like me and you right now. But I cannot deal with over 100 people. Being in an event of 100 people, I just keep quiet and, they drain me. My energies just go out the window when there's a lot of people. But if I'm forced to present, I have to. There's nothing I can do.
Yeah.
I have to stand in front of the people and do what I need to do. But it takes a lot of preparation because you'll be anxious. You're looking at all the failures, possibilities of if I fail. What if I have a tongue slip here? So it's quite a process for me to stand in front of people. And it's so weird because I'm an educator. For me to stand in front of people and say something, it's very difficult. And nobody believes that I'm an introvert, But
or maybe it's because how you talk, or how you are so out there. But then again, like you said, you're so free when you're with people in small crowds.
The thing is, I'm not shy. I'm not the shyest person in the room, unfortunately. I'm very confident, I'm very assertive. But when it comes to big spaces, I lose my energy. It's just like, I'd rather sit and listen than be the noise in the room. I can't do that. I can be noisy in my space, but find me in another space, you'll be like, is this Kwanele? Yeah, it is me. So that is me, So what was your question again?
With BA law.
BA law. So what happened was when I finished matric in 2008, I had so many funny things, when things are not meant to happen at that time. So I took a gap year.
Okay.
Because I couldn't get my matric results, only to get them like later in March. I matriculated at a time where you needed to go to the university to deliver the results, and then they accept you.
Yeah.
And then, it was just a horrible time. I wish that I graduated, maybe I finished my matric 2 years later from 2008, because after that universities had access to your matric, and then they'll give you your results back. So I had a gap year. And then I wanted to do accounting. I don't even know why. I think it was because I was doing commerce in high school. I was doing accounting, business studies and everything. So I thought, because, that for me, accounting, I knew for a fact that it was something that everyone in my class was thinking. Because you're in a commerce class, everyone's like, yeah, we're going to be chartered accountants. You're going to be an economist. And you channeled through that path without exactly knowing what your passion is. So because of that gap year, I ended up not even applying for accounting the following year. I was like, you know what? I've always wanted to be an attorney. Deep down in my heart.
Even if you were in commerce,
yes, I've always wanted to be an attorney. Why not? Let me just apply for a BA degree. And then I was like, let me add law, because I wanted more courses, because I didn't want to do LLB straight up. Okay. I just wanted to have a versatile type of law degree, So I applied at Verts and I got accepted, and then I started my BA law journey. In the midst of my BA law journey, first year, boom, I fall pregnant. The usual. Yeah,
we figure varsity.
The degree babies. I was shattered. I went through a lot during that time. So
and this is in first year?
This is in 2010, first year at Verts, fall pregnant. And it was like expected. That thing of, when you go into, when you're the first person to go into university in your family, you have extended families, you have everyone in the family, and everyone is looking at you like, oh, some are saying we shall see what's going to happen. We're waiting. It's like there's someone who's waiting for you to fail. And there's people that are happy for you genuinely. They wish for you to study. Because I remember there was someone at a point who was even asking me, how long is BA law? I'm like, 5 years. Like, you have time. Wow. In my head, I'm like, what is going on? So
wait, but it's just to jump on that, as you're saying that there's people that will always have this opinions.
Yes.
When I finished matric, I don't know if this guy, he was dating my uncle's wife's sister.
Yeah.
He said to me, when you go to UJ, he said, you're gonna live here with the New Testament in the bag, and when you come back, you'll be having Zol and Bias.
No, do you know, it's something that as Africans, as Africans and black people, we need to start having those discussions in our families. Just because this person did not choose the route that everyone was like, we're going to retail to work, or we're going this way to the bank to work instead of getting an education, it doesn't mean that person is going to fail. Just because they're the first person
to go,
it will not make you fail. But everyone is waiting for you to fail. I knew from there that my journey is going to be tough. Because when nobody's supporting you enough and it's only probably your mom and your sister that is supporting you. She has to. But now you have like your mom and your sister that are like seeing this kind of vision that, oh, this one wants to have a degree. So we're supporting her. Then there's these other people, you know, they weigh your energies down and they manifest and you help them manifest that thing that they're saying that, 5 years. We'll see. And some tell you to your face. Relatives are weird. Yeah. Relatives have this entitlement of telling things to your face and you're like, wow, you're so brave. So it's like people use their own limitations to judge you and your vision and your goals. So they're like, oh, because I'm limited to this, you cannot get there. If I failed, who are you?
Who are you to pass?
So there's no way.
When I left work, because after matric, I went straight to work. When I left work to come to UJ, my aunt called me to say, I'm leaving a stable income because I want to follow my friends.
Wow.
And I'm going to regret it.
But did you regret it?
No, I don't.
I'm sure the aunt is regretting it now.
Well, if I was to remind her of these ways, I'm sure she is.
Yeah. So the problem is that when we fail in certain things, we think everyone is going to fail. That is why even when someone asks me about my master's journey, I'm like, it's tough for me. I don't know if it's going to work for you.
For you, yeah.
So I can't use my experience to try and motivate you because I'm going to discourage you because my experience is different.
Yeah.
So you need, and I think I learned that from them, that you can't decide on someone's life because you have failed. You have failed to own a house or a car or anything. Now you think everyone has to fail. No. There's something wrong that you did along the way. Correct that thing. Or tell that person.
It's an individual journey.
It's an individual journey. It's not yours. So for me, I was like, woo. And then October, fell pregnant. And I knew that, damn, this is over for me because my mom is very strict. My mom does not play.
I mean, you were a vet student, bro. Like, you know.
Dude, I was going to be a vetsy. Do you know what it means to be at Vets University? It's like that, you know, there's that status when you're like, I'm from Vets. I studied at Vets. You consider the brain and a half. So my mom was mad. And
I would be mad. Nguthumele esikolweni uyamita.
Asinayile ngane. Bona indoda university wona amadoda meet at that moment, you know, everything comes together. Ukuthi vele people did not believe in this.
Yeah,
they knew, man.
Such an embarrassment.
But that is when I made myself a prompt. I think that is when I had a turnaround in my life, because my mom was like, you're not gonna go to school, you have decided to be a mom.
I'm not gonna take care of this
child is gonna be taken care of by you. You decided to be a mom. And there's no child that's going to go to creche under 1 year. You will take care of this child until this child is stable enough to go to creche. And I'm like, wow. And, you know, it sounds like it's mean, but it's not. You made the decision to fall pregnant.
I mean, we are seeing people, abantu abadala, they're taking care of kids.
Yeah. And then just because someone's life has to go on, you know, I had to pay for that. I had to pay for that decision because it was a decision. You know, it's a decision to have sexual intercourse. It's a decision to keep the pregnancy. And you have to live through the consequences. I think that is the whole point of this thing. You had to live through the consequences of wow. So I took 2 years taking care of my daughter, not knowing what I'm even going to do. Do I go back to Vets? What do I do? And one day in 2012, I stumbled on nursing. And now I'm sitting there, I'm like, hey, wait. How do you even think of going to do nursing when you were doing something? I was an arts person. I love writing essays. I love reading novels. Now all of a sudden I want to go into a social science. Nursing. I remember most of the people that I went to high school with were like, you want to be a nurse? Kwanele, are you sure? You know, it was like very weird. Like,
yeah, I mean, from BA law in Verds.
Yeah, and I think most of my friends knew that I'm not the most caring person. Like, how are you gonna care for another human being?
Are you not a caring
you
person?
just mean, you know.
Are you not a caring person?
Well, nursing taught me to care. Nursing did something to me, you know. So in my head, I'm like, I'm not even caring. Let me just, you know, another thing that drew me closer was, and then I'm looking at the college application. They're like, there's a stipend. Then I'm looking at my child. I'm like, no, she's gonna go to crash.
Yeah.
Let me.
This could work.
Let me take a leap on this one. If this fails, God doesn't love me. This God, He needs to bless me now. I can't. I'm like, I can sit at home. I have nothing to give this child. I'm tired, you know. And there was this whole notion of, if you fall pregnant at varsity or even at matric, your life is over.
That's what drags people.
Your life is over, and most people give up. You know, you stop dreaming. You lose all your dreams now, and it makes it look like now your life is dedicated to that child. And then the next minute you're gonna raise this child with the bitterness of not pursuing your goals. And then you're gonna be saying you're gonna be wanting this child to pay back when they're successful, because they cost you your dream, as if you sent them to be your kids when it was your decision. So for you to correct that mistake, it needs to come from you, not the child, because the child ends up carrying the load of, my mom dropped out of university. And I think that is one thing that I kept on telling myself, that I don't want to be that mom that will keep on saying, yeah, I dropped out of university.
Could have been a lawyer.
I could have been this, I could have been that. So I was like, you know what? If this is going to be my inspiration, this baby is going to push me. This baby is going to make me get that first degree, because I knew that I wanted the degree to get to a PhD level. So I was like, so be it.
Are you saying to me the stipend was what attracted you to nursing?
Oh!
I like your honesty.
I'm not gonna lie. No,
I like your honesty, because that's what most people, that's what I get from most people, right? So someone said, dude, I was not working, I needed money. And here's this course that says I should study. They want to give me money.
Exactly. I'm really not gonna lie, because I looked at my first push was like, this money can take my daughter to school, and I'll come out with something. Either I'm gonna come out with a degree, because I had applied for a diploma and a degree. So UJ accepted me, I think, quicker. Then I had to do interviews at college, and then they accepted me later that year in December. Yeah. But you know what was very interesting about this whole journey was, when I applied at UJ, and then they accepted me, and then I applied at college, and I went for an interview. And then that time when I went for an interview, I knew that I was accepted at UJ. I was just going for an interview, because I'd already told myself, you know, since I was a university student, I'm going to go the UJ route, you know. And I remember I prayed, and I was like, if I'm meant to be a nurse, please, can I be accepted also at college? To show that
I'm
telling you, I've used signs a lot. Like, it's been long since I've been using signs. I'm like, if I really am meant to be a nurse, I'll respect this journey. I know I want the money, but I want to respect this journey as a divine journey for me, because nursing, you're dealing with people. I was very aware that I'm dealing with their life here. Someone can die just from me doing something stupid. So I'm like, if I'm meant to be in this journey, and you want to be with me and guide me through this journey, the nursing college needs to give me an acceptance letter. UJ has accepted me. But if the nursing college accepts me, I go into UJ to work as hard as I can, to be the best nurse that I can be, because this is divine intervention. This is what you've wanted for me. This is why I couldn't go to varsity post-matric. I had a gap year. This is why I even fell pregnant. Sometimes, yes, it's my doing, but it's also directed to a certain level, you know? And when I got that acceptance letter in December, I was like, done. I'm a nurse.
That's it.
Period. So even the hunger and the drive that I had, I knew that it was confirmed by God. God proved it to me. He gave me the sign that either way, I wanted you either at college or at university level to do nursing. So that was my opportunity that year. And to sit and think that there's people that have applied for nursing every year in and year out, and they never got accepted. and I got accepted in 2 spaces. I
On
was
your
like,
first attempt.
there's on my first attempt, on my first hearing that there's something called nursing.
You applied and you got in.
Just like that.
Do you think out of 10 students or out of 10 people applying for nursing, what do you think their reasons are? In terms of money and passion, if you were to put it in ratios.
Do you know there's something I want to clarify? Ne?
Yeah.
I always hear people saying that there's no passion, passion. I learned about passion when I started nursing. You can't develop passion in something you haven't experienced. Passion is about experience. Passion is about overcoming the challenges of the job. Then amid all those challenges, amid the negative things that come with that job, you develop a love. You develop something that wakes you up in the morning and say, God, do that for someone. That is passion. So I don't believe that someone wakes up in the morning and has passion for nursing when they've never dealt with the worst, when you've never dealt with a person that has a fractured skull, when you've never dealt with a dying person. You can't tell me you have passion. What are you passionate about? The fact that you've helped your grandmother when they were sick, that is not passion, that is humanity. You have to help your grandmother. You need to help your grandmother. That does not identify you as a nurse.
So everyone has humanity.
Everyone has humanity. Everyone can has that
the spirit
compassion.
Of Ubuntu.
Yeah. You have to have that compassion, you know, and something trains you to understand that the human body has blood. You can't be disgusted by that. You are there to help that person. So at some point you need to, that the moment you start seeing all those things that you think will make you vomit, and you don't, and you still put a smile on your face and like, you know what? I did my job today. That is passion.
Me and you, we saw a nurse. We saw a nurse that nearly vomited on a patient.
Yeah. Dude. No, that one is not. No, but passion is about being in the firing line, being at war.
Yeah.
A soldier that's gonna tell me that they have passion is the one that has gone to war
and has
seen the things. You can't tell me I want to be a soldier because I have passion for defending people. Where do you get passion? Comes with experience. Passion comes with wanting to give up one day, but then there's something that says, who's gonna do it if you give up? There's days that I'm like, you know what? That is why I went into academics, because clinical was taking a lot from me, emotionally and spiritually. So I was like, you know what? I think I'll have a better influence in academia than in clinical, because in clinical there's so much of this going on. You know, we're bent out by a lot of things. We have doctors that are rude. You have to be dealing with someone's ego there.
Before you can deal with the patient.
Exactly. I'm not dealing with the patient only. It's the ego of the doctor, the ego of the nurses. The sometimes they are mean. You know, you get to an environment where you die and suffer for being a degree student. I think those are things that people don't talk about. That nurses abuse each other. There's professional bullying in nursing.
So nurses a degree holder.
The moment they hear that you're from UJ, everything changes.
When uzobhala ma report?
Aw, angisufunde kakhulu. Everything changes. You know, it's so sad that we are carers, but we don't take care of each other. And I always say to people, I'm grateful of the lecturers that taught me from first year till fourth year till now. You know, my supervisors till now. I've been with UJ. Sometimes I'm always saying no, but UJ is cheap. I'm realizing now that UJ people, most of them care. They teach you how to care as a nurse so that you can be able to care for your patients. There is no other better teaching of care than caring. I cannot teach you how to care if I don't care. I need to care for you to go and give it to that person. And as a lecturer, I need to care for my students. I cannot obsess about making them fail. I need to care for their well-being so that when they go out there with that theory information, they can be able to take that inner caring that I gave them and deliver it to the patient. Because if I don't care, they are frustrated, they're anxious, they're pissed off. How do you care when you're sad? How do you care when you're stressed and when you're crying and when you're grieving? You won't be able to care because you want to care about yourself. You want to care about your own emotions that are sad. So nurses fail when we go into clinical as graduates, they fail to take care of each other. They fail to, and I swear to God, when I was done with my ComServe, I made sure that every person that crosses my path as a student or a ComServe in clinical, I hold their hand. I put you in my pocket if needs be. If I'm going to the toilet, you're going with me. Because I want you to understand the essence of caring and nursing so that you can go and just be you with the patient. When you're at peace with yourself, when you're self-aware and you love yourself and you're happy with yourself, you're able to have other people. And nurses, when they're sad with their salaries, angry with the world,
with the hospital
you
conditions.
spread that toxicity everywhere. That is why people in nursing, you find that someone works 2 years, they're gone. 1 year, they're gone. Because nurses don't know how to take care of each other. Excuse me. And these are the people that are supposed to take care of the patient.
They're vulnerable.
Now we can't even take care of each other. We're healthy and fine, but we don't have that decency of saying, how are you doing? Are you doing well? Because we have a personal life outside. I have problems that really sometimes I will take to work. But then it will take someone who's my colleague to see that and care, especially nurse leaders, your managers. Your managers should be very open-minded to understand that there's days that if I'm not okay, you have to tell your employee, go home and rest. And that becomes a faithful employee in the long run. That's the employee that you listen to their emotions will always be loyal to you. If you treat me like I'm an entity, a human resource, I'm gone.
Because you don't care about me.
Exactly.
You just care about the work and...
Because how do I take care of other people when I'm not taken care of? When I'm always complaining, I'm always crying, I'm always... even if the salary is like where I'm at right now, it's not about the money. It's really, like, for the first time in my life, I'm like, I don't care about the money.
Because it's enough, you get too much.
No, it's not too much, but... it's enough. But what stands out for me is the care. Once you're cared for, your loyalty starts depending. You're even scared to get a new opportunity that has a better salary and leave.
Because you might not get the care.
You're taken care of. There's someone who considers your feelings, who you are as a person. There's someone when you tell them I'm not feeling well, they're like, no, sleep. Go to the doctor or what. They don't bother you. They check up on you. So as nurses, we don't take care of each other at all. We just mean